Hello friends, welcome back to the channel, welcome back to UK Dreamers. I'm Dr. Aman and today we'll be talking about the higher specialty training in the medical specialties, how to apply for ST3 or ST4 and pearls of wisdom. So before we go ahead, I want to make a clear disclaimer that I do not represent the deaneries, nor the NHS, nor the GMC, Royal Colleges, or any of the hospital trusts. These videos are only for colleagues like you who wish to get to train in the UK, work in the UK, and are not sure about it. So the thing that you can see on the screen, this is the basic workup for the UK training program. The first one that you see on the blue, the foundation years, these are mostly the our colleagues who either have graduated in the UK or have come through the PLAB route. The purple one, as you can see, the internal medicine training. So this is the core training pathway basically, which is of 3 years now ideally, and we are supposed to get the MRCP done during this time, and then everyone applies to the higher specialty training, which have been divided into group 1 and group 2, depending on the specialty that you take. Once we finish those years, we finish the requirements, then we get the CCT and become a consultant in the UK or anywhere in the world. So how does this affect us? Are you a doctor with MRCP? Are you a doctor on MTI or any of the sponsorship schemes? Are you a doctor with ample experience in your own specialty and do possess a GMC? Or are you a doctor who wants to get a CCT from the UK? So this video is for you. Watch till the end. So the group 1 specialties, basically the framework that they did. So they've made few specialties which work as group 1 and few as group 2. So you can see there's an endless list basically: cardiology, gastroenterology, acute medicine, diabetes, endocrinology, neurology, palliative care, renal medicine, whatnot. So the reason I'm showing this to you, this will be helpful to us in the coming slides. Group 2 specialties, on the other hand, you can see it has dermatology, hematology, immunology, infectious disease, and hence and so forth. Also, if you want to train in the critical care, intensive care medicine, this is also coming under the group 2 specialties. So let's clear the scenario with an example, for instance. So we've got Dr. Singh, who is a general medical specialist from India, has done his MD medicine. You can be Dr. Khan from Pakistan, who's done FCPS. You can be Dr. Mahmood, who's done part 1, part 2 MRCP from Bangladesh, or you can be any dear colleague from any part of the world. This just to highlight things, not to emphasize any specific country. So for instance, Dr. Singh is here in the UK on the MTI scheme. He's on a tier 5 visa. He's been here for about 8-9 months, and he has finished his MRCP part 1 and part 2 now in the month, and yes, his papers is awaited next year. So during the month of November, he listens his colleagues talking about the applications. Have you done things on Oriel? Have you done your application? Which posts are you applying, and all and all. So this makes him curious, and he wants to know what's happening actually. And then he wants to go ahead and do the same, but he's not aware, unsure what to do. So there are 2 broad options for you doctors. First, you can apply either for an internal medicine training, which is the core training program, 3 years followed by 4 years of a higher specialty program, or you can directly apply to ST3 or ST4, that is the higher specialty program. So I've just given a brief timeline for the applications. For the IMTs, yes, there is round 1 and round 2. This year there was no round, there won't be any round 2. There's just round 1. Applications for round 1 opens in November. You apply for the applications, do what is asked, upload the required documents. CREST form is what you will be needing if you want to apply for IMT. I'll make a separate video about that, or you can serve over online. So once you have all these documents, you apply, and then you get some interview slots. You do your interviews, then you get your offers of the various posts. You accept them, hence and so forth. Similar goes with ST3, ST4, that is the higher specialty training. There are 2 rounds, round 1 and 2. Round 1 is usually the ones that open in November, post starts in August. Round 2 are the one that the post opens in July and the post starts in February. So we will discuss about that later. So what do you need basically? If you have full MRCP, you've got a GMC in place, or you're planning to apply for the GMC with the full MRCP, and you have the alternate certificate to enter higher specialty, you are eligible to apply for the higher specialty. What does this alternate certificate means? So if you go to the website that's been in the detail I've given here, so there is a separate set of documents, separate set of competencies that are expected of you to have, and once you have all of those, then only you can apply for higher specialty training. So how does this work? Who is going to sign these? For instance, if you're working as a trust grade or a specialty grade doctor already here in the UK, or an MTI doctor here in the UK, you would be designated clinical educational supervisors. So if you show all these competencies, demonstrate all these competencies well enough, your educational supervisor may sign your alternate competency form. What if you've been here in the UK for 6 months, but if you see, when you see all the alternate competency forms, you think you have done most of the part back in the home country where you came from? You can also get it signed from your consultant, professors, supervisors back in your home country who are ready to sign it for you. The only thing the recruitment, the system wants is you to have this form. They don't say you have to have it in the UK. They don't say you have to have it from your overseas sponsor. You can have it from either of them if you are, fulfilling the criteria. Please go and have a look at these forms, because it's a very, very extensive list, and there are lots and loads of departmental issues. You need to have ITU experience, critical care, competency signed off. There's so many things. So few trust would be encouraging you to do these. You work for them for a couple of years and they will get it signed. Few would say that we don't have any programs, and few would definitely give some way or the other. But if you have already done plenty of work back in your home countries, you can always get it from your home countries if it is accepted. I've made a video about the internal medicine training. All you need to know, you can go to the channel and have a look at it. It's fairly simple, but if you want to get more, whether you are suited for IMT and all, you can always go and check this out. So let's briefly talk about the higher specialty training. Higher specialty training, as I had shown you earlier, the different specialties. So the group 1 specialties would make you enter the training at a ST4 level. So you finish ST4, ST5, ST6, ST7, 4 years, and you get a dual specialization, dual CCT in the specialty plus general medicine. So for instance, you entered into respiratory medicine. After you finished ST7, you get a CCT in respiratory medicine and general medicine. The working pattern is a little different, because if you go for a group 1 specialties, you would have to work as a medical registrar, taking care of the entire hospital, in terms of general medicine, or taking referrals from the A&E department as an acute medicine registrar. So it becomes it's a different work-life balance when it comes to the group 1 specialties. Similarly, for the group 2 specialties, you enter at ST3, ST3, ST4, ST5, ST6. You do not get a dual CCT here. You will just get the specialization in the field that you have done your postgraduate training. So for instance, if you apply for dermatology, you will finish dermatology and you would be a dermatologist, CCT in dermatology, not with general medicine, plain dermatology. The reason I've brought up this competition ratios is because if we think it's a easy job, it's not. It's really competitive. So on the left you can see the competition ratios for last year round 2. So if you see allergy, ST3 people who had applied, there were just 4 posts for 21 applicants. Competition ratio 5.25. If you go and see, if you're very enthusiastic about dermatology, if you see the posts and the competition ratio 5.9, intensive care medicine 2.9. So it's not that easy basically. Yes, if you want to take genitourinary medicine, the competition ratio is least. If you compare this with the 2017, if you see allergy, the competition ratio was still a little less. If you see gum was more or less same, and if you see dermatology, for instance, dermatology has always been high. The reason I've brought in this slide is because ST3, ST4 applications are very competitive. So the ideal suggestion would be, if you are not doing the core training here in the UK, still invest a couple of years in the UK, at least know how the system works, what all things that you need to have, make sure that your application is a little strong, and then you go ahead and give a very skyrocket interview. So I will try to make videos about specific specialties. I'm trying to work on that. It's not easy to find people who give you their interviews, but yes, if you are a trust grade doctor looking to upgrade your skills, or extend your visa, if you are an MTI doctor and actually thinking that your 2 years are finishing, what happens that yes, you can apply for training. And if you are just working as a trust grade or a specialty doctor, and you think you should get into training, start working on the competencies, start getting the things required, the tick boxes to be ticked for you to get the alternate certificates. Once you have everything in hand, to make sure you know the dates, you keep hand on the dates when the applications open. There's a separate website called Uriel. Make a web account of it. It's free of charge, and yes, you can definitely apply for further training. Till then, keep liking the video, sharing it with your friends, and subscribing to the channel, supporting us, and cheering me out. Thank you so much. Take care. Cheers. Bye.